So, hello everyone! I'm Arlene Brun from Tarlac State University College of Nursing BSN 2B. So, for today, I will be performing the HAT application compress. And then, for the purpose is we need to relieve the muscle spasm and also it reduces or decreasing the joint stiffness and also it stimulate the circulations of the um, and also promotes healing and also it provides or it reduces the inflammations or the edema and also extensibility of collagen and tissue and also it provides comfort and also relief and for example the hemorrhoids and then for the assessment we need to assess the following. So, we need to identify at least two identifiers of the patient. So, ma'am, check ko lang po, ma'am, yung wristband po ninyo. Okay po, ma'am. Okay, correct patient po. And then, after that is we need to refer to the healthcare providers or the order of type of the moist and the heat application, location, duration of the applications, and also desired temperature of the agency policy. And then after that is we need to perform the hand hygiene to remove all the microorganism. And then after that is we need also to assess around the area of the skin to be treated. And also we need to perform neurovascular assessment for the sensitivity of the temperature and also the pain, assuming that we already done assessing the neurovascular of the patient. So I will check the skin of the patient. Ma'am, check ko lang po ma'am yung skin po ninyo. Sakit po ba ma'am? Okay po ma'am. And then after that is we need to repair to the patient medical record if there is any kinds of contraindication. Check lang po natin ma'am kung may contraindication po sa medical records po ninyo. Okay po. And then after that is we need to inspect the wound for the size, the color, odor, and also the drainage. So, ma'am, check ko lang po, ma'am, yung size po ng wounds po ninyo or yung sugat po ninyo. Tsaka po yung amoy niya po. Tapos po also yung color. Okay po, ma'am. And then, after that is we need to assess the patient's for the blood pressure. So, I have here the BP apparatus. So, ma'am, kuhanan ko lang po kayo ng blood pressure. Okay po ma'am, normal naman po yung blood pressure po ninyo. Alisin na po natin. And also ma'am, check ko lang din po yung pulse rate po ninyo. If it is normal. Okay po. After that is we need to assess the patient's mobility. So ma'am, maaari nyo po bang galaw-galawin yung kamay po ninyo? Okay po, ma'am. Sa kabila po, ma'am. Pwede nyo po bang spread tong yung left hand po ninyo and also yung right hand ninyo? Masakit po ba, ma'am? Okay po, ma'am. And then after that is we need also to assess the patient level of comforts. So, ma'am, nung tinataas nyo po yung kamay ninyo, may nararamdaman po ba kayo na sakit or pain na nararamdaman sa pagtaas po ng mga kamay po ninyo, ganon. Okay po, ma'am. And then, after that, we need also to assess the patients or the member of the family to understand the applications and the related safety factors. So, ma'am, ito pong gagawin po natin ngayon is magbibigay po ako sa inyo ng gaya po ng sinabi ko kanina, magbibigay po ako sa inyo ng heat compress na kung saan po is to provide healing and also comfort po sa wounds po ninyo. And may idea po ba kayo kung ano po yung mga possible factors po sa gagawin po natin? It is safe naman po ma'am kapag ginagawa or nakikika-operate po kayo sa akin and pina-follow nyo po yung mga instructions po na binibigay ko po sa inyo. Okay po ma'am? Sige po ma'am, thank you po. Stub half-light or half-filled rather, and also we had the pitcher or the water and the bath temperature and the bath blanket and also the Epsom of sort. It is optional only. And then after that, for the implementation, we need to move on for the procedure. We need to introduce yourself to the patients, verify the patients, and explain what you're going to do, why it is necessary, and how the patients can cooperate to you. And then, so, magandang umaga ma'am. So, ako po yung nurse po na ngayong araw na to. And ako po si Arlene Brun. And maaari ko po bang malaman yung pangalan nyo ma'am? Patingin po ng wristband po ninyo. Okay po ma'am. And then, so ma'am, gaya po ng sinabi ko po sa inyo kanina, it also relieve your pain and it also provide the healing of your wounds po. Sabi ko nga po kanina sa inyo na safe po siya kapag sinusunod nyo po yung mga instructions ko po sa inyo na gagawin po ninyo. And also po ma'am, wala po kayong dapat pangamba dahil ang gagawin po natin ngayon is makakapagbigay po sa inyo ng comfort na kung saan is magiging maayos or mapapabuti po yung nararamdaman po ninyo. Okay po ba yun, ma'am? Magkika-operate po ba kayo sa akin, ma'am? Okay po, ma'am. Thank you po. And then, after that is we need to provide the patient privacy, like close the door and also the curtains. And then, we need to position the patient in bed and keep affected part in the area or in a proper alignment and expose only the area to be treated and cover the drape yung area na hindi natin kailangan or hindi dapat. So, expose natin yung area lang na necessary sa gagawin nating procedure. And then, after that is we need to place the waterproof pad under the wrist of the patient rather. So, ma'am, maglalagay lang po ako dito sa ano po ninyo, sa may wrist po ninyo. And then, after that is, we need to apply the sterile compress. Give the heat solution to the desired temperature properly, and we need to prepare aquathermia pad if it is needed, and also the temperature if needed. So I will going to remove the dressing if there is a presence in the wrist of the patient. So I will be remove the dressing of the patient in the wrist, and then I will check the or I will inspect the condition of the skin. So, ma'am, alisin lang po natin yung dressing, ha. And then, dispose it. Check ko lang po, ma'am. And then, after that is we need to perform the hand hygiene to remove all the microorganisms. And then, we need to prepare the compress. So, pour the solutions. So, we need to pour the solutions into the container using the sterile technique if it is needed, and also we will open the gauze, the sterile gauze, and put into the container. So I will use this, assuming that this is a water, and I will put this here, a hot water, and then I will open the sterile gauze. And then we will dispose it. And then after that is we need to add gauze to the container of the solutions, and it emerged, use proper antiseptic technique. We have already done with that. We put the sterile gauze on the container, and then we need to follow the instruction for the warming using the commercially prepared compress, and then we need to apply sterile or clean gloves in our hand. So we need also to perform hand hygiene before we put gloves. So I have here the gloves. And then after that, we need to pick up the sterile gauze, wrung out express or excess solutions applied to the wound to avoid the surrounding skin. So I will put the gauze, and I will put this into the skin of the patient. And then after that is we need to lift the edge of the gauze to check the if there is a presence of redness. So ma'am, check ko lang po ma'am kung meron pong presence ng redness po. Lift ko lang po ng onti ma'am ha. Okay po ma'am, there is no presence of redness po. And then after that is we need to pack the gauze snuggling in if the patient tolerated compress, and then cover all the wound surface with the hot bag. So assuming that this is a hot bag, and I will put it on the wrist of the patient. So ma'am, lagay lang po natin ito ma'am. So kamusta po yung temperature niya po ma'am? Okay naman po ba ma'am? Okay po ma'am. And then after that is we need to pack or cover the moist compress with dry sterile dressing and bath towel or pin or tie it. So I have here the we will put it on the top of the hot bag. So, ma'am, lagay lang po natin, ma'am. And then after that, we need to dispose the gloves, and also we need to perform the hand hygiene. Remove the gloves. And then perform a hand hygiene. And then after that, we need to apply the aquathermia heat or heat pack or the waterproof heating pad over the towel and keep it in a place. And also we need to change the assuming that I've already applied the aquathermia on this, and then we need to change the warm compress using the sterile technique as ordered if pad or the heat pack was not used. And also we need to apply the clean gloves or remove the pad and also the towel and compress and reassess wound and condition of the skins, and also the uh, and also we need to replace the dry sterile dressing. So I will be putting again the gloves, so I will perform a hand hygiene. And then I'll going to put the gloves. And then after we done the gloves, we now move on to assess the condition of the skin. So first, we need to remove all of this. So ma'am, alisin ko lang po ito, ma'am. Dispose all of this. And then, we need to assess the condition of the skin. Ma'am, assess ko lang po, ha? Okay po, ma'am. Masakit po ba, ma'am? Kamusta po yung pakiramdam nyo, ma'am? Okay naman po. Okay po, ma'am. And then, we need to apply the dry sterile gauze. Apply lang po natin, ma'am. And then after that is we need to help the patient into the comfortable position. So ma'am, ayusin ko lang po kayo, ma'am. Ayos lang po tayo, ma'am. So ma'am, comfortable na po ba kayo sa position po ninyong yan? Ayusin ko pa po. Sige po, ayos po tayo. Ayan po, ma'am, okay na po. Sige po, ma'am. Thank you po. Thank you din po, ma'am. And then after that is we need to dispose all the equipment or the materials that we use, and we need to perform the hand hygiene. Remove the gloves. Also, we need to perform the hand hygiene. For the Sitz baths or the warm soap to intact the skin or the wound, we need to perform the hand hygiene to remove all the microorganisms, and we need to apply the gloves and remove any kinds of dressings in the wrist of the patients, and we need to dispose the gloves after we remove the dressing to the patient's wrist. So, we need to wear the gloves. And then, after that, we already wearing the gloves. So, ma'am, alisin ko na po yung sterile dressing niyo po sa wrist niyo po, ha? Okay po, ma'am. And then, dispose it. And then, remove the gloves. And perform the hand hygiene. And then, after that is we need to inspect the wound of the patients, the skin conditions of the patient. So, ma'am, check lang po natin yung skin condition nyo po dun sa, sa pinag-alisan po natin ng sterile dressing po natin, ha? Po. Masakit po ba, ma'am? Okay po. And then, after that is we need to apply the gloves and clean the intact of the area of the wounds. And then, we need, after we clean the area, we need dispose the equipment that we use and then perform the hand hygiene. So, I will be performing a hand hygiene, and then I will wearing my gloves. And then after that, I will use a wet cotton balls to clean the area. So, ma'am, linisan lang po natin. And then discard. Then discard. Then discard. And then after that, we will dispose the gloves and perform a hand hygiene to remove all the microorganism. And then after that, I'll be going to fill the bath with warm solution and check the temperature. So, assuming that this is a bath blanket or the basin, and then I will be putting the warm water. Assuming that this is a warm water, and then I will check the temperature. Okay, okay yung temperature niya. And then after that is I will assist my patient to the bathroom, immerse the body part in the bath, and then 10 to 25 minutes or as the order, and then cover the patient with the blanket or the towel as needed. So, ma'am, pupunta po tayo sa bathroom po, ha? And then, cover ko po kayo ng blanket po doon. Okay po ba yun? And then, after that, assuming that we are already in the bathroom. So, ma'am, lagay ko lang po ito, ha? And then, I need to, po, ma'am, cover lang po natin. Cover ko lang po, ha? So, we need to wait 10 to 25 minutes. So, kumusta po kayo dyan, ma'am? Nasan ko lang po yung ano nyo, ma'am? So, assuming that we are already finished the 10 to 25 minutes, so I will remove the blanket. First, I need to assess the heart rate of the patient. So, ma'am, check lang po natin yung heart rate po ninyo to ensure that yung was not lightheaded and also that call light was within the reach. Okay po ba yun, ma'am? Check lang po natin, ma'am, ha? Okay po, ma'am. And then, after that is we will now remove the patient from the soak and dry the body. So, ma'am, alisin na po natin, ha? So, assuming that we are here in the room, so, ma'am, ayusin ko lang po, ha? And then, ipapatuyin lang po natin yung mga ano po ninyo. So, after that is, after we clean the, and place the patient into the room, we need to remove the gloves and perform the hand hygiene. And then, for the evaluation, we need to inspect the wound of the patients, and we need also to observe the skin color, the temperatures, and also the edema and sensitivity to touch. So, ma'am, check lang po natin, ha? Okay po, ma'am. Sakit po ba, ma'am? Okay po. And then after that is we need to ask the patient to describe the level of the comfort. So, ma'am, can you speak po kung ano po yung, kung paano po yung level of comfort po ninyo? Okay po, ma'am. Okay po. And then after that, we need to get or obtain the vital signs of the patients compare with the baseline. So, ma'am, kuhanan ko lang po kayo ng vital signs, ha? Kundin po natin yung ano po ninyo, ma'am, yung blood pressure po ninyo, ha? Po, ma'am, normal naman po. And then after that, we need to ask the patient to demonstrate to us on how they understand the procedure or the step of applying hot compress in their home. So, ma'am, ask ko lang po, ma'am, kung ano po yung naintindihan nyo sa ginawa po natin at pwede nyo po ma-apply sa bahay po ninyo. Okay po, ma'am. And then after that is we need to identify the unexpected outcome. And then for the recording and reporting, record all the information of the procedures and record the procedures and post-procedures and the vital signs and document the evaluations of the patients or the caregiver learning. And then we need to perform a hand hygiene again.